Hi, in this video I'm going to talk about how you can get ready for your first appointment. What should you know before you go in? What should you expect? And how can you take the absolute best care of yourself after being diagnosed with breast cancer? Being diagnosed with breast cancer is a major interruption of your life story. You were busy enough with kids, family, work, your community, and all of a sudden you're sort of lifted up out of your life. That interruption in your life story can be really traumatic. Getting prepared for your first visit and knowing what to expect can help you absorb what your choices are and how to get the most out of your doctor visits. When you're first diagnosed with breast cancer, there's a lot of appointments. You'll see a surgeon. You've already seen somebody who did a mammogram, most likely. You've had a biopsy. You're going to see maybe a medical oncologist, somebody like me who gives hormonal therapy, anti-estrogen therapy, and chemotherapy and other treatments. You might see a radiation therapist. You might see a physical therapist, a social worker. It's really good to know who you'll be seeing the first day. And it's completely fine when somebody calls you with your appointment to say, what kind of doctors will I see? What should I expect? You can also learn more about what to expect by visiting yerba.com and getting your personalized report. But in general, it's really good to go in with about 3 key questions. And the reason I say 3 is because getting much more information than that can be overwhelming. The other thing is each doctor is going to have their own specialty. So they're going to be a surgeon or a radiation doctor or a medical oncologist. So having a set of questions ahead of time can help your clinicians, your medical team, know where you are in understanding your diagnosis. One thing that I find really helpful is to ask people, where are you with this diagnosis and what do you know about it? How can I be most helpful? So you can tell your clinician, your medical team, this is what I know and this is what would be most helpful. You're going to hear a lot about your diagnosis. You'll learn about the stage, the type. Is it infiltrating ductal, for example? You'll hear things that maybe you aren't that comfortable listening to, like the HER2 status and estrogen and progesterone and grade. It's confusing with stage. You can see our other videos on what the difference is between grade and stage and learn about estrogen receptors and the HER2 protein. Maybe you might not be ready for all of that, but there's some information that's available when you need it. You're going to learn about your treatment options, and depending on the person on your medical team you're seeing, you're going to learn about surgery, maybe radiation therapy, maybe getting chemotherapy before surgery. Maybe you'll hear about genetic testing to see if you have an inherited gene. So it can be quite overwhelming. What I recommend is that you bring somebody with you and have that person bring a pad of paper so they can write things down. I also recommend, if possible, that you audio tape your appointment. It's been shown that people who go to the doctor and audio tape that consultation are much more satisfied with their visit. Of course, we recommend that you ask the people in the room, can I audio tape you? And tell them why. And they may not be comfortable with that. Don't be surprised or shocked. You can, of course, be upset. Nobody can tell you how to feel, but it's not uncommon for doctors to say, I'm not really comfortable with that. But if they will let you audio tape it, you can listen to it later. Different people learn different ways. You're also going to get a lot of sheets of paper or a link to a website. So a lot about your diagnosis, a lot about treatment. It's really good to know what kind of doctors you're going to see. It's common these days to see multiple doctors in one day. Can you imagine? You've just been told you have breast cancer. Now you're going to see 3 different doctors, maybe a plastic surgeon, and you don't even know what kind of surgery you're going to have. Just try to sort of focus on where you are, put your hands on your belly, take notes. Don't worry about asking questions over and over again. We work for you. We're here for you. We want to take the best care of you. And you need to know what's going to happen next. And again, the different doctors you see may say, I don't know that. You're going to learn that from another doctor. And that's part of that first appointment. I'm going to talk next about when you see the surgeon. So the surgeon is a person nearly every person with breast cancer will see. There are some cancers where we don't do surgery. If the cancer is advanced or metastatic and spread to other parts of the body, we often don't do surgery on the breast itself. But for most people, a surgeon will be involved in your care. The surgeons focus on diagnosing and removing the cancer from the breast and the surrounding lymph nodes or glands under the arm. And there's other areas in the neighborhood of the chest. You can learn more about that in our other videos linked below. So the surgeon wants to know, where is the cancer? how big is it, and they want to take it out. So they're going to focus not on things like chemotherapy or radiation therapy, but what we call local control of the breast cancer in the neighborhood, local or regional even, which involves the lymph nodes. The surgeon will be in charge of referring you to the medical oncologist who gives chemotherapy and hormonal therapy and other therapy that goes through your whole system, and to the radiation oncologist. General surgeons also work with plastic surgeons who are involved in helping you be the most satisfied with how the breast looks after your surgery. So that's the two types of surgeons you'll see, as a breast surgeon, and you might see a plastic surgeon. So let's talk next about radiation doctors. If you're going to your radiation appointment, you're going to learn about whether or not radiation therapy is necessary in your case or should be considered. That's a tricky one because they're not saying you need it and they're not saying you don't. They're saying, let's weigh the risks and benefits, and they're going to ask you what you think. They're going to give you as much information as possible. If you don't get the information you need really from any doctor, you just sort of put a stop to it and say, these are the things I need to know. This is what's important to me. Tell me again about the benefits and the risks. Tell me more about the treatment you're offering, more about plastic surgery or radiation or mastectomy or lymph node dissection. And we have a lot of videos of each of those as well on this channel. After a radiation oncologist, or sometimes the same day, or sometimes before, you'll see the kind of doctor I am, a medical oncologist. These are long appointments. Be as patient as you can because it's a lot of information. With a medical oncologist, you're talking about ways to improve your survival. So you're talking about, you'll hear about the risk of the cancer coming back. You might hear the risk of your surviving breast cancer, the likelihood you'll survive breast cancer. So it's a lot to take in. And again, bring somebody with you, audio tape the visit if you can. You can learn more about this on our videos, but you'll learn about the pros and cons of all your treatment and what to expect. Now, there are lots of visits after each of these. You'll get teaching about chemotherapy. You'll get taught about surgery. You'll be seen before your surgery. So just take what you can from the visit and don't worry again about asking other questions. Your doctors will give you phone numbers or other ways of contacting them, for example, through your patient portal on your medical record. And that's ways you can ask questions and get those answered too. Remember, we're working with you. We are your team. You're the center of the team. Our job is to give you high quality information support so you can make the best decisions, and then we partner with you to give you that treatment. These can be really hard visits, but we're going to be with you every step of the way. We're not saying this is easy. We're just saying you're not alone. I hope this video has been helpful. I know you're going through a lot. If it was helpful, can you click like and subscribe? That helps other people just like you find this channel.